you've got your business to business audience, right? And then you've got your business to consumer audience, and we're sort of seeing this shift broadly within the industry, which you see in other sectors, where you're seeing the consumerization of healthcare, right? It's not just purchased at the medical level anymore. Individuals are making a lot more healthcare decisions and sick care decisions.
Welcome to Agents of Change, a podcast about the future of B2B marketing, featuring insights from executives at top agencies. I'm Danielle O'Neil with Leadtail. Let's hop on in. Today, we're thrilled to welcome Quintin Maidment. He is VP over at the Bliss Group. Hey, Quintin.
Hey, how you doing?
Good. Hey, Quintin, I know you've got a pretty unique background that begins with political. You've done some PR, and now you're focused on healthcare. So just tell us a little bit about how you got where you are.
Sure. So I have a background that's a combination of traditional public relations, business to business mostly, biotech, healthcare, mostly, but not entirely. And also, I have more of a political background and public affairs background. I worked on campaigns when I was younger. And I did a bit of work for the city contracted with them around correctional healthcare delivery, working in sort of direct services of healthcare. And then I also, I think prior to Bliss, worked as the press secretary for SEIU Local 2015, the second largest healthcare union in the US, and a home care union, which gave me a lot of deep knowledge of Medicare. Of Medicaid, and how that program works and is funded. And I've been able to take this sort of unique experience of both, profits, as well as profits in a metaphysical sense, and sort of bring that to a lot of the work that I do nowadays, which is across the entire healthcare spectrum at the Bliss Group. So everything from medical devices, biopharma, and the business of healthcare, which is consultants, as well as payers. So how healthcare is discovered, how it's delivered, how it's paid for, and how it's promoted.
Yeah, absolutely. Well, and talking about these advancements and some of these challenges, how do you feel that these challenges are really kind of helping the marketing trends develop in another way?
Hmm. Well, like a lot of other industries, healthcare is highly regulated, and so there's lots of challenges standing out, right? You have to say everything that complies in the regulatory way, and oftentimes the default is to be kind of boring. And I think that what makes healthcare marketing so exciting is that you have to be, um, much like Twitter, right, requires you to be pithy because you've only got 240 characters. In some ways, you have to really try to be creative in this industry, and really try to create content that stands out and create marketing plays that stand out. And that's one thing I think that's where healthcare uh, um, in is an exciting place as a marketer to be.
Yeah, absolutely. Well, and with those kind of communication trends, especially given that you're highly regulated when it comes to your messaging. So how do you really work within these trends given those limitations that you have?
I think within healthcare, right, there's always, and one place where we sort of differentiate ourselves from our competitors is that we work across the healthcare spectrum. So life sciences, payers, providers, talent, tech companies, the whole sort of everything from healthcare to sick care, to how it's all paid for, right? And there's always two audiences within healthcare, maybe multiple, right? You've got your business to business audience, right? And then you've got your business to consumer audience, and we're sort of seeing this shift broadly within the industry, which you see in other sectors, where you're seeing the consumerization of healthcare, right? It's not just purchased at the medical level anymore. Individuals are making a lot more healthcare decisions and sick care decisions. And I think that one place where the healthcare sector is able to actually lead the way. And one of the things one of our clients, they're a nurse staffing. They're a two-sided marketplace for healthcare talent. So they help match clinicians, travel and permanent, with jobs in hospital systems, and jobs in jobs in hospital systems and jobs with travel agencies. You need a very specific skill set. Licenses don't necessarily transfer across state lines. There's very challenging things as to why that could be successful. And they work a lot with influencers on TikTok, of course. And that's sort of that. And I think within some of the clinical trial work that we do, we're always forced to operate in new channels and with new mediums. And that a lot of, our clients are quite risk adverse for very legitimate reasons. And so I think that when we work in healthcare in these new platforms, that's when some of the more interesting and creative work gets done. And also I think you're seeing really, which is impacting not just us, but every communicator, regardless of sector, is that the definition of a journalist is really changing, right? There's no Walter Cronkite anymore. There's no this one central truth of authority anymore. And from a media relations perspective, you've got to do more. We've got trade press that we have to do. There are major YouTube channels that have significant influence when it comes to how doctors and consumers make healthcare decisions. We do clinical trial work, right, where some of the most influential people to help recruit patients can be clergy or trusted community members. And how can we sort of map and understand webs of influences in entire communities? Is I think that you're seeing in healthcare and you're seeing across the sector is that data is informing more of our decisions, particularly in terms of understanding how people consume news. And it isn't just the same, you've got your 5 publications, you can go out to them. And you've got some of our healthcare clients, right? A profile story, a quote in the Wall Street Journal is great. New York Times, no client's ever going to fire us over that, right? But if you're selling a medical device to a hospital system, your best audience might be the Trade Association for Value Analysis Committees, getting in front of some of the consultants who work with them, maybe talking to the Healthcare Financial Management Association about the financial implications of how you can help hospital systems save money, reduce readmissions, improve quality scores, and I think that what's makes some of the work that we do the most creative and the most interesting and exciting is getting in front of some of these niche audiences and actually getting to the people who are making the purchasing decisions for our clients, which varies by every single one of them, of course.
Yeah. And so thinking about like that buyer and the person that's making those decisions, do you find that it really comes down to you're going to have to change that messaging for that B2B buyer versus the B2C? And if so, how do you adjust that messaging, especially on the fly when we're talking about trends and TikTok and some of these others?
Yeah, so I think maybe within the context of clinical trials might be some of the more interesting examples. So we work a lot to recruit patients for clinical trials. It's work that we started to do as a result of Operation Warp Speed during the pandemic, and the motivations for a patient, right? This could be a way to treat my condition. This will allow me to contribute towards science, are very different than that of an MD. And family physicians can be a huge source of referral traffic for you if you can get them on your side, but they're often roadblocks. And they often advise patients against participating in clinical trials because there's risks, because they're unfamiliar with the trial. And obviously the benefits are it's a clinical trial, it's not proven. And so I think some of the how we speak to medical professionals and understanding that preempting the conversation that we have ultimately that the patient and the medical doctor is going to have, and making sure that the medical doctor um, fully understands the scope, knows the understanding of the research behind the trial, why it's going on, what some of the existing literature say, what are the risks of this treatment, and making sure that family physicians in an area that you're or referring physicians in general in an area where you have trial sites is making sure that they understand things on a scientific and technical level goes a long way to allowing patients to participate. And I think broadly speaking, if there's to answer your question, I think writ large, I think one area that the public relations industry often falls short is that it lacks a level of understanding of clients' businesses. And I think that when you're looking at who your buyer is and who you're ultimately going to purchase your is going to purchase your client's products, it comes down to really understanding how the money sloshes through the healthcare system, who influences who, what are the relationships, between the various players and the interconnectedness and sort of what are, when you speak to a physician for a medical device, right, they might care about the whiz bang technology, they care about the innovations, the slight improvements of quality. You go to a hospital value analysis committee, that could be wildly different if you're going to a safety net hospital system, which needs something that's going to, reduce readmission risk, even if the device is more expensive. If it reduces the 30-day readmission risk, that's significant amounts of money in terms of insurance reimbursements to them. And I think one area where the industry doesn't always hit it is getting always an understanding the business impact of the PR work that you do.
Yep. Yep. Absolutely. So, how do you help explain that business impact to them when you're coming up with campaign strategies and really trying to advise them on next steps?
Yeah, I mean it's all about thinking about um your audience and the behaviors that you want them to take. Oftentimes with clients, it's that they're selling to multiple groups, and so it's explaining, it's having concentrated campaigns and your broader thought leadership, to reach all of the audiences that you need, and make sure that fundamentally at the end of the question, okay, does this media placement, does this piece of marketing collateral, at the end of the day, advance our clients, a thought leader in the industry? Does it make someone do something that we want them to do, whether that's have a meeting, whether that's purchase a product, or whether it's go to a website and review information on a trial. Is everything that we're doing actually having impact on what we want people to actually do? And I think broadly speaking, we're seeing a huge fragmentation of the media. And so broadly speaking, when it comes to PR, I think you have to do more now than you used to. And so it involves sort of going after as many outlets, trying to get as much coverage as possible. And from a business perspective, these top tier placements and trade placements can often, often those trade placements can be really valuable. Sometimes you get lucky and people reach out to clients after reading their name, and that's always a great way to see your business impact. But it's really about, I think, making sure that our clients are speaking to the people who actually matter and actually make the decisions. And oftentimes uh, that can vary on who that is for what client we're dealing with.
So, Quentin, what does moving the needle mean specifically in healthcare when you're thinking about these clinical trials?
Yeah, so I mean that mostly comes down to patient to getting patients to sign up and join the trial, both in terms of raw numbers as well as raw speed. You speed up a clinical trial by 6 months. That can be hundreds of millions of dollars in value, to a CRO or to a sponsor. But also too, I mean um, you find out it works, great. You're now 6 months ahead of time. You can bring this medicine to a patient that needs it. Find out it doesn't work, also great. You've now found out 6 months earlier that that this is a waste of time. No more resources get put into this. No more scientific talent is wasting their time spinning their wheels on a molecule that's not gonna work. And so I think that there's a lot of impact to be had within improving a clinical trial. Actually, the number one reason that a pharmaceutical company can't bring a drug to market is they can't find enough patients to test it on. And this is often a bigger problem in diseases that impact minorities. There's been lots of struggles to bring sickle cell treatments to market because it's quite hard to test those drugs in the US because of historical distrust in the medical establishment. So I think there's a lot of real impact and driving business value within fixing basically a broken patient recruitment. If you got COVID last year, the last thing you're thinking of, and this was a global pandemic, you get COVID, wall to wall coverage on this. The last thing you're thinking of is, oh, I should go sign up for a clinical trial and let's help me find a treatment that we can give to those who get test positive in 6 months or whatever. And this was you had every single public health agency in America focused on this problem, and this was still one area where I think we all as a country sort of fell short, was moving people into clinical trials who had tested positive, who had been exposed. We had a lot of stuff on vaccine treatments, but this was sorry on vaccine studies. But this is it's not something that you think of as a consumer, and it's like where do I turn? I've just tested positive, and I think if we can solve this problem For other medical conditions, I think we'll see scientific innovation power longevity, power quality of life, and again improve the lives of millions of people, and bring more drugs to market, and bring them to market at a lower cost too.
So, Quintin, you have such a wide array of
Hmm.
experience within the healthcare industry itself. So, have you seen any emerging technologies that marketers need to be aware of when thinking about healthcare, and particularly if they're coming up with new ideas, new campaigns, new ways to really get their message on behalf of their clients out to their audiences?
So I think there's two big tech trends, really three, but let's not talk about AI, because I think AI within biopharma discovery is a whole 5-hour conversation alone. I think if we're looking from a marketing perspective, there's going to be two big changes. From a tech perspective, right? On one hand, you have AR, augmented reality, virtual reality. That's going to transform physician education. Why are you going to send in-person sales reps when you can basically create a virtual surgery room? In you've got VR glasses, you can do this, you can teach people how to use your new medical device, you can do medical education that way. And I think looking at how everyone knows, Zoom, basic telecommuting stuff, but how that increasingly merges with the physical world, especially when it comes to products that involve mechanisms of action within the body, is going to be something that I think marketers are going to have to be super aware of. Search media relations, broadly speaking, we're seeing voice technology that consumers are using, and that's you now, it's important to be on your Dr. Google, is the primary care physician for majority of American healthcare consumers. That's now going to go down to the top result if you're asking Siri or you're asking Alexa for help with that. I'd say that those are probably your two big marketing specific trends. And the other trend I would look at within healthcare is looking at wearable technology and its intersection with telemedicine. In many ways, that empowers consumers to make more healthcare decisions, and you'll see this increasing consumerization of healthcare. Is that take the we're all familiar with COVID testing now, right? The idea of having testing yourself, seeing if you're positive, seeing if you're negative. That's something that nobody really did pre-pandemic. The FDA has recently given an emergency use authorization to a medical device that can test COVID, RSV, and flu and tell you which one you have, right? Think about how we did this pre-pandemic. If you thought you were sick, you would go sit in a room full of other sick people, and a doctor would test you. And if you didn't have something when you walked in the door, you did by the time you left. Now that consumers are going to be able to do that at home, and you combine that with telemedicine, if some of the regulatory you have that, you have prescribing. So you get your home test, you get your prescription from your doctor, you don't have to leave it, and you can go to the pharmacy and get the drug to treat whether it's COVID, whether it's RSV, or whether it's flu, depending on what you have. And I think you're going to see a lot more diagnostic technology. And then when you're going to see that combined with telehealth, combined with wearable technology, there's lots of weird regulatory things around. Let's say my Apple, I don't have an Apple Watch, but say I had an Apple Watch, and that could tell me something's up with my heart. And it can sort of monitor the signs of heart disease are noticeable. You can see the buildup if you're actually monitoring and scanning for it. But if I show up to the hospital, would the hospital admit me based on what my smartwatch is saying, and would my insurer be willing to pay for it? And that's, I think, where you're going to see a lot of advancements in the future, and you're going to see consumers making more healthcare decisions based on diagnostic technology and based on wearable technology. And as marketers, we're going to have to be prepared for that shift.
All right. So, Quentin, what are you reading right now? And what would you suggest other marketers within this space spend some time learning?
Hmm. Funny, I'm actually reading the book that was given to me at my company's annual retreat. It's called Learn to Leap. It's by Kip Knight. Used to be a CMO high up. Yeah, used to be a CMO high up in Yum Brands and P&G. It's like a memoir self-help book. It's if you read it for what it is, which is a memoir self-help book, it's a pretty good version of that genre. And that's a pretty exciting, fun read. I I have an ever-growing reading list, and it depends on how many delays there are on the subway in terms of how much reading I get done. I would say, um, What's a good book I've been reading recently? Yeah, I mean, I mostly read like nonfiction. I read a lot of history books. I read some marketing books, but not a huge amount. I think once I'm out of work and it's pleasure reading, it's books that interest me more than marketing books. I think if I was going to pick one area to study, and I was gonna be like, okay, I want to know everything about this trend, I'd pick LinkedIn personally. That's the one thing I want to know, and I think that's the most. There's the eyeballs that you get on LinkedIn. The number of consumers of content far outpace the producers of content on LinkedIn, and I think it's the only social platform where that's still true.
So would you say that LinkedIn is your favorite channel?
I'd say it's probably if you were going to pick one channel to focus on, especially in business to business, I would pick LinkedIn. Both as an employee to grow your career, as a company to grow a business, as a place to demonstrate thought leadership. There's a reason that they hired all those journalists, and that they've been doing their LinkedIn news stuff. You've got demand for humanized business content that's on LinkedIn. You get a lot of eyeballs for what you do. You have full control over the content. Um, I think it's a very powerful channel. I think lots of people are waking up to that fact, but I think it's the world has too many tweets. The world has a million Instagram posts, but there still is a demand for more content on LinkedIn, and I think that's what makes it unique over the some of the other platforms. But again, I think it's also you're not going to directly sell makeup on LinkedIn on consumers. Maybe you are. It's not something I work in hugely, but it's all about the channel to your audience. But I think LinkedIn's an incredibly powerful platform.
Mhm. Yeah, absolutely. And it's fun to see all the different changes that LinkedIn is making and trying to find new ways to connect with everybody on the platform.
Yeah.
So it's always good to see when they're adding new ways for us.
Yeah.
So as we kind of wrap up today, Quentin, is there any last parting advice that you would give to any new marketers within the healthcare industry? Anything that you would say, spend time learning this or put less focus on this and more focus on
Yeah.
that?
I mean, maybe this is common advice, especially within media relations and public relations, where I spend most of my time. It's read the trade press. Really read the reporters and the publications that deeply cover your industry. In the healthcare press, there's an ever never-ending number of healthcare trade publications to read. But I would say that they're not always the lightest of bedtime reading. They're not always the most the deep dives. They can be kind of very technical and boring, so to speak, but it's so important to know, and they often have some of the best coverage of the industry that you work in. And I think if I give any advice to younger employees and those studying their career in healthcare marketing, it's pick up the trade publications, whether it's Stat, Pharma Voice, Clinical Leader, Life Sciences Leader, um, health affairs, and really focus on just being a never-ending sponge of information, and just trying to constantly read and understand what reporters are writing for, what makes a story, what's trending in the industry, where is the industry going, not only tomorrow but 5 years from now. And obviously, if you're in healthcare, very important to keep up with CMS rule changes, and keep up with the regulatory environment. Healthcare is 50% of all healthcare purchases in the US are made by the government already. That number's, we've got an aging population, more people are going on Medicare, huge growth opportunity for the industry, but really understanding how companies will have to transform their workforces, their ways that they do business, how they fundamentally do innovation, as a result of pressure that you have, and often cross pressure that you have from DC or from Wall Street, and understanding how everything intersects. And really understanding the industry, which again I think comes back to having a mindset that's always, let's learn more, let's read more, let's understand more, let's speak to smart people and work with smart people. I think that's the best advice that I can have is to try to be an information sponge as much as possible.
Sponge
Yeah,
it all
exactly.
up. Absolutely. Absolutely. Well, Quentin, thank you so much for being
Oh,
on with
absolutely.
us today. And thank you for coming and sharing all of your great advice and ideas, especially given an industry that's so toughly
Yeah,
regulated that I can only imagine how hard it is to really get your voice across. So we appreciate this so much. We will drop all of your information in show notes. And thank you, Quintin. And we hope everybody joins us for our next episode of Agents of Change here with Lead
brilliant.
Tail.
Thank you so much.